To extra depth now on the mask mandate debate. Today, one of the state's top infectious disease specialists questioned why it's still in place when El Paso has more than 75% of its eligible population vaccinated against COVID-19. ABC 7's Rachel Phillips joins us live to break down why El Paso's health authority, Dr. Hector Ocaranza, says the mandate is still in place and when we might see it lifted. Rachel.
Steph, just last week, County Judge Ricardo Samaniego and Mayor Oscar Lisa announced El Paso reached herd immunity. They said that because more than 75% of eligible people were fully vaccinated. That's when I asked them this. What makes you confident that you can tell that we've reached herd immunity when really the goalpost could be further away than what we are right now?
Well, the confidence is what the mayor is saying. As long as the community continues to do what they've done, we're always, it's like being ahead at the football game and we're leading at the fourth quarter. I'd rather be leading than losing at that fourth quarter.
We take our guidance and recommendation from the Public Health Authority and Dr. Ocaranza and the guidance, and we'll continue to do that.
Today, I asked Dr. Ocaranza that same question. How are you comfortable calling it herd immunity when the CDC says there isn't really even a number that can define herd immunity right now because of the Delta variant?
We cannot define very well what herd immunity is.
So are you saying now that El Paso hasn't reached herd immunity?
Again, the term of the herd immunity, as you mentioned, the experts cannot define very well what the herd immunity is. So that's why it's hard to tell you a hard yes or a hard no. Yes, we reach a goal that we established initially that is going to give us a level of protection, but it's better to have a higher level of protection with more infectious variants in our community.
Both the county judge and the mayor were out there last week saying, we have reached herd immunity, and they were saying that is off the basis of your recommendations. Yes, so for you to now backtrack, it's a little confusing.
Well, not precisely backtracking, but actually the pandemic has been very dynamic, and definitely we can say that we have reached that herd immunity that we established initially.
Now, I do want to bring in one of the top infectious disease specialists in the state, Dr. Okachika Alozi. Dr. Alozi, today you tweeted, quote, "Hey, El Paso, you can't have it both ways. You can't crow about being vaccinated and yet have a performative indoor mask mandate that nobody follows," end quote. Dr. Alozi, can you explain what you meant by that tweet and where your frustration lies?
Yeah, I don't even think it's frustration. I think it's a good thought experiment. I think at the end of the day, right, mandates aren't meant to last forever. And so we have to have a real and honest conversation. What are the benchmarks? And so if we say we've hit herd immunity, we can argue about that one way or the other. At what point are we removing the mask mandate? Is it 75? Is it 85? And I think people that actually understand the epidemiology of the COVID virus also understand that we're probably at 80 to 90% immunity in this community because of the people that have already been infected.
Dr. Alozi, today I told Dr. Ocaranza about your tweet. He told me the mask mandate is still in place to protect our healthcare resources, despite the high vaccination rate. And Dr. Ocaranza says there are approximately 170,000 people unvaccinated in our community. He says about 10 to 20% of them could need hospitalization. He told me that while he thinks the vaccine is the best way to fight the virus, we need to be using a combination of interventions, including wearing a mask.
When you have a community that has a lot of risk factors, when you have a large number of people that are still susceptible, we need to use a combination of tools that is going to make it successful.
And so, Dr. Alozi, you touched on it just a moment ago, but in your professional opinion, considering our high vaccination rate, should El Paso still have a mask mandate in place? And should people still be wearing masks in public places?
Well, I think the question is different, or I'm going to frame it differently. The real question is, what's the risk, right? And so what is the exit strategy? What's the off-ramp to this? So we have a mask mandate, and part of mandates are political and not necessarily scientific. So if we say that we initiated this mask mandate a month ago, 2 months ago, when do we get off? Is it when kids get vaccinated? Is it when we hit 80%? And so I think those are honest and obvious questions that need to be answered. And so it's not just enough to say, hey, we have a mask mandate and we're just going to continue it ab initio and forever ad infinitum. There has to be an end product.
With all the back and forth and disagreements about whether masks should be mandatory, many El Pasoans are left scratching their heads.
I just believe that, some people are just getting it, a little confused with the whole thing.
Everybody's saying one thing, another. Some stores enforcing it, some stores aren't. So, but yeah, I think people are confused right now with the mask mandates.
Dr. Alozi, what's the one thing that you want El Pasoans to know right now?
I think the most important part is this. If the riddle is COVID, the answer is vaccines. It's the primary and most important part to protecting yourselves. There are individuals that are going to need masks, but again, like some of your viewers said, the reality is this. If you go out anywhere in El Paso, a minimal amount of people are actually wearing masks, restaurants, gyms, bars. And so I think we just need to rethink it and have a true conversation about what are the metrics that create that off-ramp.
Dr. Lozzi, thanks so much for taking the time to join us tonight. Steph and Eric, back to you.
Thank you, Dr. Lozzi, and thank you, Rachel. Meanwhile, Dr. Ocaranza told ABC7 today we're in a, quote, very nice position with a high percentage of vaccination in our community. So we asked when we will be seeing the mask mandate dropped.
And Eric, Dr. Ocaranza couldn't give us a day, a vaccination rate, or a definitive answer, but he did tell us this.
We're looking at the number of positive cases every day in a 7-day average, and we're looking at the hospital number of hospitalizations, so we can see that there's a declining trend, and we have to establish a trend for at least 14 days so we can see where we're going.
But take a look at your screen right now. This is the data on elpasostrong.org or epstrong.org. You can see at the top the 7-day average of decline in cases is over 21 days, and the 7-day average for days of decline in hospitalizations is more than 14 days, as you can see again at the top of this page.